grace on that, and welcome to our Satsang journey. Join us as we aim to have real, relevant, and meaningful conversations. My name is Hirsch, and I'm from Houston, and I'll be your host today. And before we get started, we do have a small disclaimer. With our topic being mental health, overcoming the stigma, please note that everything we discuss today should not be taken as medical advice. The opinions and materials spoken are solely of the host and the guest and are not reflective of any other persons or organization. If you have any questions or concerns about your own personal health, just like any other medical topic, please consult a trusted medical professional. I'd like to introduce our guest, Dr. Snehal Patel, a practicing psychiatrist in San Antonio. Thank you for joining us today, Dr. Snehal Patel. Just wanted to give you an opportunity to give a brief introduction on your education background and how you got into the practice of psychiatry.
Thank you, Harsh. That's a privilege to talk about this. And thanks for coming from all the way to Houston to record this for our Yuvak and youth. So I was born and raised in India. I did my medical school from India. As after finishing the med school, I came to United States to do master's, and then I did residency in psychiatry. I wasn't interested in psychiatry from the beginning of my med school. I started developing interest after I came to United States and after I did some clinical rounds with my mentor and realized mental health is such an important field, but it is so neglected, not just by the South Asian community, but also by American community as well. And that's what I decided I wanted to help the people who are suffering from mental health and decided to go to psychiatry residency. And with God's blessing, I was able to finish my residency, got board certification in psychiatry, and now practicing psychiatry in at least 20 to 25 states in United States and covering age groups starting from like 8 years, as young as 8 years old, until like 95 to 100 years old.
Wow, that's incredible. So yeah, thank you again for your time. Funny you mentioned that this is a field that's fairly neglected. When I was doing my research, one of the things that surprised me was from the World Health Organization, they state that 1 in 8 people are affected by mental health. And from their definition, they went from experiences that people have internally, even physiosocial experiences, and all the way up to self-harm. Now, I come from a business background. I work in consulting. So my definition of mental health is just strictly what's in the textbook. I don't have any real world application. From your experience and from your clinical understanding, is your definition a little bit different, or is there a tweaking that I should do to help me understand?
Right. So let's clarify a few things. How to define a mental health. That's where we are going. According to the National Institute of Health, or NIH, and DSM-5, which is the Diagnostic and Statistical Manual for psychiatrists to diagnose a patient with a psychiatric illness, how do they define it? I would just like to quote the definition from the book is, it is clinically important syndrome. There is collection of the symptoms that can affect the person from his ability to perform task, or it makes it disable or distress the patient in forms of social, personal, and occupational functioning. So that is a kind of self-defining definition. If your mental health, if your anxiety or depression or hopelessness or anything else that is going on, it's affecting your interpersonal, social, or occupational functioning, that's when you need to seek help. So the data you mentioned from WHO is accurate. I think it might be even more than what WHO is telling us, because it's always accessibility to the health system in diagnosing patient with the mental health problem is a problem. Okay, if we look at the data from United States, adult in United States have 23% chance of having a mental health problem. So that's close to 59.3 million people. 1 in 6 individual may be suffering from some kind of mental health. If you take gender, female have more prevalence of having mental health issues. And if you take race, the people who identify them associated with 2 races, they have more chances of having the mental health. So it's everywhere. We just need to identify it.
Gotcha. And do you see differences in maybe age ranges as well? Let's say young adults versus people that are in their 25 to 40 range, and then anybody that's older than 40. Is there differences in how the symptoms present themselves or maybe even the signs?
So yes, your young population from, I would say, 25 to 45 has the highest amount of mental health disorders. The younger population has disorder from like 8 to 15%, but which is much different than what you see in the younger population. Geriatric population also has a problem, but they are usually coexist with the neurological problem or medical issues, uh, and they are also ranging from 15 to 20%.
You did mention generalized anxiety and depression. And when I was doing my research, those two were one of the or two of the more common ones that people tend to experience. At least from my perspective, how would I know if I'm just stressed out and sad versus I've got generalized anxiety, I have depression, I need clinical help?
Right. So as we mentioned in the definition, how we diagnose patient, that's exactly the same criteria you should use for your own assessment. Okay. If this anxiety you having, if this hopelessness or low energy you are having, or whatever symptoms, if it is affecting your performance in job, you are not getting promotions or not able to attend the meeting, and that's why you're missing out that next raise. So if it is affecting your occupation or your social life, that's when you need to seek treatment. There are some tests, or we call it inventory, that you just answer on your own. I'm sure there are so many apps with the social media being so influential that is approved by NIH or DSM-5. You should do one of those questionnaires, and that can help you guide into the direction that whether you need help or you are okay.
And those questionnaires, that's something we should typically do annually, right? Or is it something we should do more often?
Most of the primary care clinics I have seen and encountered, they do give their patient those inventory questions, and that's the self-assessment questions. Be honest when you answer those questions, and don't just throw it off. Okay, this is not pertaining to me. Try to see if there is something that you need to address. So honestly, answer those questions, and that can get you to the right help that you need.
And I want to piggyback on that statement of being honest, right? Because sometimes when I think of mental health, at least from my minimal understanding of the kind of the information that's there, I might think that it's just a phase or it's all in my head. Um, is there any truth to that, or how should we treat that statement?
So I would say 50% of my patients, when I talk to them and try to get that initial evaluation, if I ask them if there is any family history, they would invariably say if it is a Hispanic population or African American or our Asian population or whites, we don't talk about this in home. If I talk to my father, if there is a history of depression on your side, he'd say no, because there is a stigma attached to it. We don't treat mental health as a real health issue. If we have a heart issue or a kidney issue or lung issue, we'll talk about it. But mental health is not being discussed in family also. And there are various reasons for that, like the culture we grew in. Uh, our South Asian population would not go to the doctors and talk about that because they might have a language barrier and they don't want to explain what's going on, or they don't have access to the healthcare and they don't go. So if we say there is a disparity, we have a disparity in our South Asian population because of some of the reasons that would prevent people from asking for help.
Yeah, and also another aspect of our lives in satsang, right? I, I know there are times when we talk a little bit of prapti no vichara and different, you know, manans that we can have. But do you see any clinical appreciation of some of those practices as well that, hey, these are some practices that we use in my clinic that are also paralleled in satsang?
So if you look at the evolution of mental health, okay, there is a biological aspect of mental health and there is an environmental aspect of the mental health. Biological mean you were born with a issue with your neurotransmitter, like you had low serotonin in your body or had high dopamine in your body. That I know that's more technical terms, but you were born with that and you have mental health. And then you have environmental factor. You have stress in your life, something going on at job, something going on in family, you can't sleep. Those kind of exacerbate your symptoms of mental health. Okay. uh, Being satsangi, being in contact with people, I think that is one of the major hurdle in America. Is we have a very fragmented nuclear families, and most of the people gather like on the 31st or 1st or 4th of July, and on the other day they just kind of go on with their own life. So that social contact is not there, and that is one of the major issue why we see mental health more in America, and particularly in our age group and also in the culture.
Another stigma I was just thinking about is, especially in our South Asian or Indian community, we talk about, bija badasu kaise, right? What will the others say? Do you see patients that come in with that sort of hesitancy where they're saying, I'm afraid of what other people will think when I come talk to you as a patient? Or how do you even address that?
Right. So, and that's a very valid question, Harshvai. So there are people when the problem gets out of the control, they call me, or if they see me at Monday, they'll kind of pull me aside and talk to me about it. But they'd say invariably, "Koi na jode baat na karta. I have a question for you. My son is going through this, or my dad is having this problem." So there is a stigma attached to that, and we need to shake it off. Mental health is a real problem. It's a real biological problem, like you having a blood pressure issue or diabetes problem. You got to talk about it. And that's where we're going to discuss today also is how to identify those early on symptoms so that we can get addressed. So rather than being stigmatized by it, we should be openly talking about it. This is an era of talking openly. So we don't want you to kind of just talk about depression all the time, but don't shy or hide away from it if you experience some symptoms for sure.
Yeah, and even talking about some of those symptoms that you'd mentioned, right? I Is there certain patient populations or generations that have different stigmas that they experience? Maybe someone my age that might have a different experience than someone who's older?
Absolutely. Because the disease process is different. And that's why the stigma is going to be different. As I say, like I'm the first generation. I was born partially in India and raised and came here. Like somebody like you who was born and raised here. So you have a different cultural influence than I have from India. So the stigmas and the way we think how mental health work is going to be different for sure. But it affects everyone exactly the same. The symptoms of depression are going to be the same. The neurochemistry behind it is going to be the same. But sure, the stigma and the symptoms could be little different.
Sure. And let's say, for example, I come to you at Mandir, right? We have this rapport as satsangis, but I have a little bit of hesitancy on whether we should meet in a clinical setting. What would you kind of tell me to reassure me as someone that's in the same satsang fellowship to empower me to come talk to you in a clinical sense?
Right. So again, understanding that mental health is a real problem, understanding that there is a help there out there which can help you get better. It is not in cancer or some terminal illness that is never going to get better. Or you don't have to accept it and just continue to live your life. So I'm sure Maharaj and Swami also talk about this, about the mental health. So we need to understand, accept the reality, and then talk about it. Uh, no one is going to feel bad or no one is going to kind of stigmatize you because you have a mental illness. We need to get that concept right in us and the whole satsang community that it's okay to have mental health problem. You just need to ask for help.
And another thing when we were talking on the side was, nobody has a challenge when someone has diabetes or has heart disease. Why is this any different?
I don't know. I think because the nomenclature is bad. I think psychiatry itself is trying to change it. From mentally ill to mental health to now we call it behavioral health diseases. So I think it's a problem from our own medical community too. We put it the words in a way that kind of demeaning to the people. Like up in India, okay, આ તો ગાંડો છે. It's not gato. It's like depression is different than being mentally ill, right? Anyone can suffer from that. So I think it's a partially problem with the medical community and the society and how it has been portrayed so far for last 100 years. So I think it's a big change to do it. But a podcast like this and educational sessions like this would bring that awareness so we can talk more openly to ourselves, to family, and to a satsang community also.
That's perfect. And kind of talking about ourselves and switching gears a little bit, for someone that's my age, right, from 25 to 35, this is usually referenced as these are your building years, right? You're building your career, you're building your family, you're even building satsang. And to a larger sense, a lot of yuvaks and yuftis spent the last few years building akshardham, where they may have had to step away from work or step away from family obligations. Now that they're coming back, they've got a lot on their plate, right? They want to grow in satsang, they want to grow in their professional careers, they want to grow their family. This is possibly an avenue where anxiety could creep in for even the best of folks with even the strongest samjan. What would you tell someone where they start feeling like they have a lot on their plate, a lot to deal with? How would you provide some support to them or help to them?
So I think it's an extremely good questions. And what you mentioned that these are the building year of your life. You are building your career. You are building your family. So if you have a mental health illness and it throttles your progress at age 25 or before you even go to college, that's going to affect your life in the longevity compared to the person who developed depression at age 45. I mean, it's going to affect them, but they already have their life established and they can maybe maneuver their life a little bit better than the younger population. So, your age group from 25 to 45, they are the prime target where we need to bring that awareness that there is help available. Going back to your question of how would you control your anxiety or depression being a satsangi? I think we hear Swami talks about this a lot. Praptino Vichar every 15 minutes. Build Akshardham within. Okay. Bhagwan na karta harta pananu mahima. So those are the things, if we kind of really understand and put it in practice, that would help you extremely well to control this anxiety and depression. Let me explain you why. Okay. Most of the people develop anxiety or depression because they start comparing them or their achievement with their peers or with somebody in satsang or somebody who is superior to their or somebody who progressed more than when they progressed. So if you have a real understanding of prapti no mahima, કે જે ભગવાન આપણને મળ્યા છે એ સર્વોપરી ભગવાન છે અને સ્વામી આપણને ભગવાનની જોડે અક્ષરધામમાં લઈ જવાના છે. So then your ultimate goal of what you want to achieve in life gets kind of go on to that rather than just achieving the Laukik sukh that you are trying to achieve. That temporary defocus from achieving the Laukik sukh and focusing on Maharaj and Swami can help you alleviate that anxiety and depression to a significant level. And if you do that on a daily basis, you would almost become immune to those anxiety and depression that a person who is not in satsang would experience. So, in a way, satsang has guarded us from this depression and anxiety if we take it in a positive meaning.
Yeah, and that kind of reminds me of the Prasang in 1974 when Brahmukh Swami Maharaj was doing his first overseas tour after Yogiji Maharaj had passed and went to Akshardham. You know, he went over to Nairobi and the officials there didn't even let him get off of the plane. And it's like they say, Rato Rat, they had to go back to Mumbai. And all of the people that didn't know what happened in Nairobi, who had just did the Viday of Brahma Swami Maharaj, were now wondering, why is Brahma Swami Maharaj doing morning puja? And so when they asked Brahma Swami Maharaj, how did you feel about this? Tamaru apman thai gyu. Brahma Swami Maharaj said, look, this is all Maharaj ni ichha. He didn't let any of that affect him. And there's countless prasangs like that, whether that's getting the land for London Mandir or even North America, all of the legal issues they had with Chino Hills, getting the height requirements, and even some of the challenges that were faced, internationally, whether it was the Akshardham shooting, things like that, where if it was me, if I didn't have that samjan, I would be immediately stressed or having, panic attacks or even depression, just wondering, why is all of this happening to me? And yet the sthiti that Pramukh Sai Maharaj has was just completely stable. It's almost as if, like, you know, not even a drop of water had fallen, it was still. It's kind of just mimicking what you were talking about. Um, yeah, those practices, it seems kind of foreign, right? We've got something that's very traditional and Praptino Vichar, Maimano Vichar, but then you also see modern practices of it. I mean, my phone tells me, hey, it's time to be mindful for 1 minute today, right? Do you see any other practices that we are already doing with our daily anik that mimic treatment options that you give some of your patients that are not Satsi?
So that's a very keen observation on your part, Harshvai. I would say I've been practicing psychiatry. Mostly do biological psychiatry. What that means is we prescribe medications to help patient out with their mental health, but we also do some therapy. Okay, so if you look at Praftino Mahima and try to change your behavior because you understood that concept of Praftino Mahima, and now you are changing your behavior or how your body responds to that particular stress that you are experiencing in your real life. It's what we call a cognitive behavior restructuring, or CBT. Many of our audience might have heard about that too. People charge hundreds of dollars to go to CBT. It's years and years of therapy that you need to do with the therapist, sitting down there for hours and hours to change one cognition in your brain, to change your perception of the reality that is there. So that cognitive behavior restructuring is something we get every Sunday or every day when we do Gar Sabha. And we get our cognition restructured to change the ultimate outcome. I would give you another example for anxiety. Okay. What anxiety is the overload of cortisol in your body. Okay. That gives you somatic or a bodily representation of the anxiety. Like you get a sweaty palm, you feel like the heart is racing, you're having problem breathing, you see things are getting blurry. That's called a panic attack. Okay. The treatment in the panic attack is something what we call a guided imagery, or even a mild hypnosis, or some other techniques that we use. What guided imagery is that you imagine yourself in a peaceful place. Most of the Americans, they think on the beach, right? So you imagine yourself on a beach, having fun, listening to the music that takes you back to that beach, and try to relax yourself and bring you out of the anxiety attack. We get it for free. And you will wonder how. Every time when I go to evening arti at Mandir, at the end of the arti, there is a small piece, I would say like 10 or 15 minutes, where there is a disclaimer. Okay, now put all your bodily images out and consider yourself that you are watching Maharaj taking his Shayam Bhojan, and close your eyes and there is a music and you imagine Maharaj and Swami are eating their bhojan or taking their Ratri dinner, and you kind of calm yourself down. After guided imagery, the level of cortisol drops at least 20 to 30%, which is more effective than even taking the medication. And we getting it for free at our Monday every day. And you can do that every day in your Mansi Puja, in your Nitya Puja. You can start your day with the guided imagery, and that would set you on a course of success every single day after the daily puja.
It's funny you also mentioned that when you were talking about going to your happy place and then having that imagery in your head, one of the first things that I think of is during Cheshta, where where you go from almost like uh, following Maharaj day to day, every activity that he was doing, and then you're just imagining that in your head. If you could also do that, that could help you, right? It almost mimics that same sort of release of that cortisol that's affecting your body. We touched upon how mental health and stigmas on an individual level, but I wanted to talk a little bit on the community level. And you referenced it a little bit earlier, where satsang does add sort of a protective layer that other people might not have. When I was doing my research, one of the big things that came up was the loneliness epidemic, right? In a world that is so connected from social media and the internet, we still feel distant and apart from those around us. Um, what are some of the things that satsang does to help us connect with people, far deeper than follows or likes or shares on social media?
Building those mandir, what it has done, it has given us that protection from loneliness in America. Because India ma, though we have connection, social environment, we have somebody living next door who is our neighbor or our family. Here, it's hard to find. So what Maharaj and Swami has done is they have given us Gar Sabha, then Ravi Sabha, then some of our regional celebration, national celebration, and international celebration. What that does is that brings the whole community together. The Sam Sruhad Bhavan Ekta that Swami talks about, I don't feel any different when I go to Houston or Atlanta or Chicago. Everywhere I have my Satsangi brothers and sisters there to help me out in any needs. My son, he is in high school, he is going to college. We are looking at colleges, but we will look for a mandir next to the college so that he doesn't feel lonely and we don't have to worry about him that, okay, what's going to happen to him? He will have some support. So this layers and layers and layers of the social protection that Swami has given to us, it's a barrier for us to get a mental health if we utilize it to the best manner that Swami wants us to do.
But I think the caveat there is that we're not immune, right? We do have protection, and there is that layer that's gonna kind of put us in the best position possible, but there might be some biological reasons why we still experience mental health, right? There is overlap, but it's not exclusive, right? Just to make sure.
Right. So I think we don't want anybody to stay in a false sense of security that because I'm satsangi, I'm not going to have mental health. As you rightly said, you still have the biology or you still have the genes of having those mental health, then you're going to have it. But you will be well prepared or you have a good support system to deal with those, and you would not end up with somebody who don't have any support system. And bringing this awareness that I can have it too, that would bring mental health awareness and it would keep the bad outcome away from you. This is not uh, so this is more like identifying the mental health early rather than completely eradicating by satsang. So satsang will help you stay more immune. It's more like a vaccine that would prevent you from getting it, but you still can get it. You might need treatment at that time.
Okay. That makes a lot of sense. And then kind of shifting gears to, other ways that we can help alleviate some of the symptoms. We talked about satsang and getting professional help. Is there anything that, say, I should do on a day-to-day basis to help me be a little bit healthier when it comes to these behavioral disorders?
So, I mean, I funny you said it. Like when we talk, if you have a heart attack or if you had some other issue, we said, okay, do daily exercise, control your cholesterol, uh, take your vitamin D, vitamin B12. Mental health get affected by all those too. So, like doing your daily exercise will help you increase the level of good neurotransmitter in your brain to the level that it would be affected by like a medication. So doing your daily exercise, doing your daily meditation, yoga, or whatever exercises that you do, it's extremely important. Healthy eating is always extremely helpful. Or sattvic eating, that what we kind of recommend in Monday, it's also extremely important. So don't substitute because you are satsangi and you have more power to cope with this problem. You still need to do what a healthy individual do on a day-to-day basis, and it would help you as good as it would help your heart health. It would help with your brain health as well.
Right. And I know we covered a lot today. what I wanted to do was, as we start concluding, is open this up to you and maybe the three main highlights, three main points that you'd want to get across to our audience. What are some of the big pieces of information you want to make sure that they understand?
I think I have 20 that I want to tell, but we'll go it down to three. So the first is I can also have mental health disorder. Second is there is a help available there for me to get out from this. And the third is Maharaj and Swami are there for me to get help, and I should talk to somebody to get some help. But that doesn't mean that one more important thing I want to tell is this is to do the self introjection. I don't want you to introject in someone else. Okay, Harshbhai, you have a problem. Okay. So we need to refrain from telling other people that I heard this podcast and okay, you might have this problem. So let's do more introjection, the self reflection of what I have. And if you see somebody, you can talk to them and say, why don't you do a self assessment of yourself too? So I think that's the message from this.
And speaking of self-assessments, do you have any resources you'd like to share to our audience that we can also put in the link below?
Right. So as I told you earlier, there are a questionnaire called inventories. There is one popular is BAPS inventory. There is also called GAD is for generalized anxiety assessment, and there is a PHQ-9. We can put the links. I think those are free links. You can do it on your own. That would give you just the basic understanding if I'm suffering for anxiety. If you feel like your performance is not up to the par and what's bothering you and all the medical healths are normal, then do those inventory and that would kind of guide you or at least nudge you in the direction of where you need to go.
And I know you mentioned those are pretty much for anxiety. Anything for any other maybe behavioral disorders like depression or
So as I said, back depression inventory is for depression. But again, there are age specific assessments. Like if you're a kid and having issue, then they have an ADHD assessment. If you're elderly, then there are some cognitive assessment that needs to be done. So it's vast and variety, and there are like thousands out there. There are some apps which are artificial intelligent would guide you in the right direction when you put your symptoms in or this is how I'm feeling, they would pop up a right assessment for you too. But this is beyond the scope of our discussion today. But keep in mind, there is help and assessment available. You should talk to your primary care and they can also guide you in the right direction as well.
Snehal Bhai, thank you so much for your time today and recording this very informative episode. And thank you for joining us on our Satsang journey. We have a feedback form below, so if you have any suggestions for future topics or any information that you would like to see discussed, please fill out that information and we'll be reviewing that. Thank you again for joining us. Jai Songhar.